Hi, my name's Mark Cameron. I'm a physiotherapist here at OTMP and leading our OTMP longevity program. I'm here today with Dr. Tim Trod, a founding partner at OTMP, to talk about our longevity program. You know, this longevity space is really evolving over the past few years, Tim, with the likes of Peter Attia packaging up and communicating lots of interesting research and data around longevity. You know, but you have your own origin story of longevity, and I'd love to hear it.
Thanks, Mark. Yeah, I'm 67 years old, and my goal has always been to be able to ski with my kids at 75. But that seems close now, 8 years, so I'm pushing it out to 80, and that's going to require some work.
You know, I think that's a great way to look at it, that we all should be looking at the future when we are into our 50s, 60s or 70s about what sort of life we want to lead. And I think our longevity program tries to capture that information, and we set some baselines today so that we can then have interventions to try to make sure as we get older that we're going in the right direction. Patients can access our longevity medicals through two different pathways. One is the full medical, and there's also a pared down version doing our longevity performance tests. But it'd be great to hear from you about the full longevity medical.
Our goal has to be to have a vibrant, productive and fun older age, and keep that going for as long as possible. You know, the concept of health span, we're all going to age, and we have to prepare for that. We have to manage that process. And the longevity medical will have all the tests you associate with a normal high-end medical examination. That is to detect disease and the risk factors for disease. In addition, we will have some tests of physical ability. That's VO2 max for fitness and standardized tests of strength and agility. We'll also add in some more in-depth tests for cardiovascular disease, apolipoprotein B, lipoprotein A, then a test of oxidative stress, which is one of the key drivers of aging. In addition, we'll be doing a DEXA scan for body composition. That is a whole body scan, a small amount of x-rays that tests your bone density, also fat percentage and distribution, and muscle mass.
That sounds very comprehensive, and there's some great data that will come out of that so that we can then offer a recommended action plan, you know, for everyone as an individual according to their tests. You know, one of the key questions I get asked is, what age can I participate in this? How old is someone who needs a longevity program? And I can tell you, Tim, I have a 32-year-old female patient who's been following Peter Attia's protocols for 2 years, and equally I have a 75-year-old patient who wants to do the full medical. So I think really you're never too young or too old.
If you lose something, it's harder to get it back in terms of fitness, mobility, strength. It's better to start early and maintain, but it's also never too late.
That's great. And I think, you know, the key takeaway points from this is that you're never too young or too old to start a longevity program, so it's time to get moving.